And my plea to Georgians is this: to keep Georgia open, to keep hardworking people employed, to keep food on the table for thousands. Please follow the guidance that we've been preaching for months now.
Governor Kemp asking us all to do our part to stop the spread of COVID-19 as we learn some good and bad news from the latest White House coronavirus task force report. Georgia is performing better than much of the country currently, but we're still in the troubling red zone. Right now, the climbing infection rate is straining our hospitals. The state reporting more than 2,600 COVID patients yesterday. That's up nearly 200 since Monday, making it the 11th day the number of people needing medical care has been above 2,000. The state also reporting more than 3,600 new infections yesterday. That brings yesterday's number to well above our weekly average for new cases. And now we know in as soon as 7 to 10 days, COVID-19 vaccines could arrive in Georgia. But the state expects it will still take months before enough doses are available for most. Joe Ripley has more on the state's plan and what they want you to do until everyone can get a shot.
Georgia health officials say the first round, amounting to several hundred thousands of doses, will go to those most vulnerable, including those in nursing homes and frontline healthcare workers. But there's still a concern of covering all of them. Georgia Public Health Commissioner Dr. Kathleen Toomey pegged January as a target to cover healthcare workers entirely. The state will work with hospitals on a distribution plan. Georgia will likely receive the Moderna and Pfizer versions of the vaccine, each requiring 2 doses to be about 95% effective. Essential workers such as power facility employees and people over the age of 65 with higher health risks would be the next to get the vaccine. Health officials say it could be several months, though, before the general public has access to the vaccine in Georgia.
People are primed and ready. The providers are ready to go. So I don't think that there's not going to be a problem of vaccine wastage. I think there's going to be, we're going to get that out.
Toomey and Governor Brian Kemp said they'd both be willing to take the vaccine to boost public confidence in its safety. Until then, Governor Kemp urged Georgians to follow CDC guidelines until a vaccine is more widely available.